Head and spine anatomy. So when we talk about the head, we can break it up into two components, the cranium and the face. The face is what we exactly think of as the face: eyes, ears, nose, mouth, jaw. The cranium is where the skull is, contains the brain and the spinal cord, so our quote-unquote head. When we look at this whole facial cranium area, there's different layers. When we talk about scalp, it's not just what we think of when we think of the scalp where our hair is. The scalp is an acronym for the different layers that cover our cranium. So S is for skin, and the skin of the scalp is much more dense than any other portion of the body. Then the next layer is C, which is connective tissue. And this is super dense, and it binds the skin to the aponeurosis, and it bleeds severely when cut. So you may be able to attest that if you've got a cut in your scalp, that it bled a lot more than normal areas. It's very painful when injured, but there's very little swelling involved there. Then the next level is your aponeurosis. So your aponeurosis is the tissue that becomes the muscles over the frontal and occipital areas, which help absorb trauma to the skull and especially glancing blows. Then we have the loose connective tissue, which is kind of a space that allows for some swelling and pus to accumulate, like a little bit of a cushion, or that's where the swelling can happen. This is where you get kind of like that goose egg mentality. Periosteum is the next layer, and that's the deepest layer, which is loosely attached to the skull or the bones of the cranium, except for in the suture lines. So the suture lines, it's attached very significantly and tightly. When we want to talk about the bones of the skull, we're going to look at first the frontal bone, meaning like your forehead, the frontal. And then we have our parietal, which is the main part of the side of our cranium. There's one on each side. The occipital, which is in the back. And the occipital protuberance is basically that bump right at the base of your skull. Then we have our temporal bone, which is right where our temple is. And then our zygomatic arch, which is basically our cheekbone. Our mastoid process is part of that, which is a little bit that sticks right underneath our ear, that little pointy part. And then our styloid process. Then we have our sphenoid bone, which is basically behind our eyes and nose. It's part of our sinus system. It kind of has much different cavities that hold our sinuses. And our ethmoid bone, which is basically right behind the nose, and it spreads out almost looking like a butterfly shape. So this is a different view. Okay, so notice the ethmoid bone is, you can see it through the eye socket, and it kind of is on both sides like the butterfly wings. And then the sphenoid bone is behind that in the base, the back part of the eye socket. So lacrimal bone, nasal bone. When I say the lacrimal bone, that's right in the inside of the nose and eye socket. Nasal bone is the nose. Maxilla is the top part of your jaw. Zygomatic is your cheek. Mandible is your jawbone. There's a body and an angle. When we say the angle of the mandible, that's the corner of our jaw. And the ramus is what goes up into our TMJ, so our temporomandibular ligament, or mandibular ligament, TMJ joint. Okay, not ligament, I apologize. Cranium. So when we talk about the cranium in general, think of it as oblong, egg-shaped collection of bones. It's designed to protect. Think of how hard. There's no openings. It's very protective. Frontal bone is a very strong bone. Think of how strong your forehead is. The temporal bone, which is on the side, is significantly weaker. If you've ever gotten hit in the side of the head, it hurts a lot more than if you get hit in the front. Occipital bone is the most posterior bone, and that's where the spinal cord passes through the foramen magnum. Remember, anytime you see foramen, means a hole. This is a very large hole, hence foramen magnum. The parietal bone is basically the sides of the main portion of the cranium. Now we have the dura. The dura is the outermost layer of meninges or membrane that's attached between the bones and the brain. Okay, so there's 3 layers. There's the dura mater, which is the outermost layer, and it's made of strong white fibrous tissue. Then we've got the arachnoid membrane, which is delicate and web-like, and the innermost. And then we've got the pia mater that adheres to the outer surface of the brain and contains the blood vessels. Okay, so those are layers. Then we have the dural space. So the spaces among the dura. So we've got the epidural space, the subdural space, and the subarachnoid space. Basically, anywhere above the dura, in between the dura, in between the arachnoid and the dura. So when we go into the brain, the 4 major areas of the brain, we've got the cerebral hemisphere. That's the main portion. When we think of a brain, we think of the cerebral hemisphere. That's the gray matter. There's divisions from there, though, of left and right. And then there's subdivisions of those, which we call lobes. We've got the frontal lobe, parietal lobe, occipital lobe, and temporal lobe. So when we think of the brain, we've got the big section, and then we divide it left and right, and then it goes from divisions from there to lobes. Now, if you think about it, there's a frontal bone, there's a frontal lobe. They're going to be in the same location. Parietal bone, parietal lobe, same location. We have the diencephalon, which is the uppermost region of the brainstem. So this is where the brain turns from brain to brainstem. And it has 3 major divisions: the thalamus, the hypothalamus, and the epithalamus. Then it goes into more the brain stem. So the brain stem is the control center of the brain, and it consists of the medulla oblongata, the pons, and the midbrain. The cerebellum is what is below the brain stem, and it's beneath the occipital lobe. It's that extra brain looking thing. So here's a picture of what we're talking about here. So the blue is the frontal lobe, the red is the parietal lobes, then we've got the occipital lobe in the back. Then the cerebellum, see how it's kind of that little brain underneath the brain? And then we have our brain stem, and we have the pons and the medulla. When I talked about the brain stem, the medulla oblongata, pons, and midbrain, that's what we're talking about right there where it says brain stem. When I mention the thalamus and hypothalamus and epithalamus, that's within the brain, okay? So if you cut the brain in half, now you can see that hypothalamus area and the thalamus and the midbrain. See in that center component of the brain. So if we want to break it up into this, the brain stem is the junction box of the central nervous system, meaning it controls pretty much everything, okay? Everything goes through the brain stem. Upper regions of the brain send signal here to be passed to the spinal cord. So this is where we decide where it goes into the body. Then we've got our cerebellum. So remember that little brain in the back, kind of a secondary brain? The cerebellum mainly controls muscle coordination and complex actions in balance. So that's where all of our athleticism comes from, is the cerebellum. The cerebrum, remember we talked about that's the main gray matter, what we think of the brain, the frontal lobe, parietal lobe, occipital lobe. That's higher thinking. This is the largest area, and like I said, it's divided into right and left, and then lobes from there. The meninges that I mentioned, they pad the brain and the spinal cord. So remember, the pia mater is the innermost layer, and it clings to the surface of the brain. The arachnoid is the web-like covering all over the brain. And then we have the dura mater, which is the outermost, and it's strong and fibrous. So more specifically, medulla oblongata. So see how it's that part of the brainstem right there? It has ascending and descending tracts. So this is where the spinal cord connects with the brain, and the tracts cross over the medulla. So it controls consciousness and reflexes. So if you damage this area, you do not regain consciousness. You do not have conscious thoughts. When we look at the pons, it also connects the spinal cord with the brain, and this is where breathing is controlled. Okay? So if we damage our brainstem, which is all of these components, we are not alive. Okay? The midbrain is our reflex center, and it controls movement of the head and the eyeballs, as well as auditory and trunk stimuli. So it's what we react to stimulus. So that's the brain and cranium anatomy. Now we're going to go into vertebral anatomy. I have a little video here.
The vertebral column consists of individual vertebrae and intervertebral discs. When viewed from the lateral aspect, we can see that it consists of various curvatures. The cervical region consists of 7 vertebrae. The thoracic region consists of 12. The lumbar region consists of 5. And lastly, we have the sacrum and coccyx, which are 2 composite bones. In this picture here, we have a superior view of a typical vertebrae. Anteriorly, we have the body, which is the weight-bearing section of the vertebrae. Posteriorly, we have the spinous process. Laterally, there are transverse processes. Both of these processes serve as attachment sites for muscle. Connecting the body to the transverse process, we have the pedicle. And the transverse process to the spinous process, we have the lamina. Together, the pedicle and the lamina create the vertebral arch. We have a pedicle and lamina on the right, and we also have one here on the left. Together, these form the vertebral foramen, which is the hole where our spinal cord would pass. Other characteristics that we can see from the superior view is we have superior articular facets on either side. We also have inferior articular facets as well, but you can't see them in this picture. I'll first describe the cervical region, which consists of 7 cervical vertebrae. These vertebrae create a concave curvature, which we can see here. C3 to C7 have common characteristics. The body is described as oval in shape. It's longer from side to side in comparison to anterior to posterior. Posteriorly, the spinous process is short. It points directly backwards and sometimes is bifid, meaning that it splits into 2. The vertebral foramen is described as triangular in shape. A unique characteristic of the cervical vertebrae is the transverse foramen, which is a hole within the transverse process. You can also see on this picture here the superior articular facets. Here again, superior articular facets, and here are the inferior ones as well. In this picture here, we can see passing through the transverse foramen is the vertebral artery. This is one of the main arteries which heads up to supply the brain. Highlighted in this animation is the axis, or C2. I will now describe C1 and C2, as these vertebrae have unique characteristics. In this animation, we can see various aspects of the atlas, or C1. A unique characteristic of C1 is that it does not have a body or a transverse process. Instead, there is an anterior vertebral arch and a posterior vertebral arch here. Replacing the body anteriorly, we have the anterior tubercle, and replacing the spinous process, we have the posterior tubercle here. Laterally, on either side, it still has a transverse process and also a transverse foramen. You can also see here these large superior articular facets, which are concave in shape. These will accommodate or articulate with the occipital bone of the skull. In this animation here, we can see different aspects of the axis, or C2. The axis is similar to all of the other cervical vertebrae, with the exception of this large prominence which projects superiorly. This is called the dens. From an inferior view, this picture here on the right, we can see the body of the axis, and we can also easily see the transverse foramen within this as well. Posteriorly, in this particular vertebrae, we can also see the spinous process is bifid, where it splits into 2. All the other characteristics of this particular vertebrae are similar to C3 to C7. The next region is the thoracic region, where we have 12 vertebrae, T1 to T12. In this picture here on the left, we have a superior view of the thoracic vertebrae, and this one here on the right, we have a lateral view. Anteriorly, we have the body, which is described as heart-shaped. Posteriorly, we have a distinguishing feature of the thoracic vertebrae, and that is this long spinous process, which slopes downwards. The vertebral foramen is described as circular in shape and is much smaller than the vertebral foramen within the cervical region. Laterally, we can also see the transverse processes and also the superior articular facets and the inferior articular facets. The distinguishing feature of the thoracic vertebrae are these costal facets, and this is where our ribs will attach. Each individual thoracic vertebrae has 2 costal facets on its body and also 1 on its transverse process. From a lateral view, when the thoracic vertebrae are stacked on top of one another, you can see that the first thoracic vertebrae is much smaller than the last one. And this is because as we descend down the vertebral column, the vertebrae have an enhanced weight-bearing function. We can also see that the thoracic vertebrae create a convex curvature or kyphotic curve. Next, we have the lumbar region, which consists of 5 vertebrae, L1 to L5. These vertebrae create a concave curvature. All 5 of the lumbar vertebrae are similar in shape. They have an increased weight-bearing function, and therefore they are quite large. Anteriorly, we have the large kidney-shaped body. Posteriorly, we have the short or blunt spinous process, which projects posteriorly. It's sometimes described as hatchet-shaped, which is the top of an axe. You can see here they resemble one another. Lastly, we have the sacrum and the coccyx, which are 2 composite bones. The sacrum consists of 5 fused vertebrae, which you can see here where they would actually fuse together. It articulates with L5, the last lumbar vertebrae, as well as both of our coxal bones, or hip bones on the side. Distally, the sacrum articulates with the coccyx, or the remnant of our embryonic tail, which typically consists of 4 fused vertebrae. At the end of this video clip, you should be able to answer the following 5 questions. Press pause and try and answer them. We will discuss the vertebral column in more detail in class.
Okay, so with that all being said, the spine in general, it has to be very strong yet very flexible, because remember, we're protecting the spinal cord, and we're supporting the body, but we also have to be able to move. So it supports the head and provides for that attachment. It encloses the spinal cord and nervous system, and it has all the small bones called vertebra. They're separated by the intervertebral discs, and these discs act like shock absorbers for the spine. There's 5 sections: the cervical, thoracic, lumbar, sacrum, and coccyx. The cervical has 7, thoracic has 12, and lumbar has 5. The sacrum and the coccyx, remember, are fused, so they don't have a set number. The spinal nerves enter and exit the spinal cord through foramens between the vertebra. So the way they sit, they basically provide a little space for the nerve to go through. If your discs are pinched or flattened or reduced or damaged, you're going to have less of that space. So that's when you have pinched nerves due to disc involvement. There's 4 curves within the spinal cord. The cervical curve is a concave. However, at birth, it's not necessarily all the same. So the cervical is concave, lumbar becomes concave, and the sacral and thoracic are convex. So when you see a child or a baby, they have one curve. It's a C curve. So as you get older and as you're able to walk and hold your head up and be upright, that's when the S curve comes in a component. A curved spine has more strength and stability than the C curve spine. So that is why when babies are first born, think of that they're literally, it's a C, they're curled up. And as we learn to walk and be stronger, that's when the lumbar changes, as well as the cervical area changes. So when we look at the vertebra individually, we're going to look at 3 basic components: the body, the foramen, and the processes. So the body is the big area, the stabilization area, the protection area, the big bulky part. The foramen, remember, is the opening. The processes, there's a bunch of them, okay? So there's going to be the transverse processes, which are out to the sides. And then you got the spinous process, which is out back towards the posterior side. When you look at the spine, you want to think of it almost like a house in the sense of the roof, where it contains the spinous processes and the articular processes. So the top part is called the lamina, okay? And then the bottom part, the sides of the house, you'd say, are the pedicles, okay? So the sides are the pedicles, and the top is the lamina, and then you have the vertebral arch, which is basically the whole thing. Now, depending on the vertebra, cervical, lumbar, or thoracic, they're all going to have different specific components to be able to identify them. Cervical, for instance, there's 7 of them. Cervical vertebra typically have longer spinous processes, and they're more delicate and they're thinner. They also are, the first 2 are very different, okay? The first 2 vertebrae are different, the atlas and the axis. This is what allows for the head to move the way it does. The atlas has no body or spinous processes, so it's literally just kind of like a circle. The axis allows for rotation of the head. Okay, so those are the differences. So if you notice in the picture on the right, those are all C4 or C3 and below. C1, C2 are different. Now, the other component of cervical vertebra is a lot of them are what's called the bispinous processes, the division of 2 at the top. So notice where it says 4th cervical vertebra, there is a separate, there's 2 of them, okay? When you look at the thoracic vertebra, you're going to have 12 of them, and they have extremely long transverse processes, and they're very predominant, and they're thin, but they're thicker than the cervical spine. Even by the pictures, notice the thickness and the generality here on these pictures, and then look at the cervical. Look how like almost like dainty and delicate they look. That's the difference, okay? Also, you're going to see the differences here. There's no holes, okay? So look at the transverse foramen. So here there's holes called the transverse foramen. There's no holes called transverse foramen here. So there's an additional hole, okay? Thoracic vertebrae have facets, which is where they sit on each other. That's where they connect. And they articulate for the ribs, okay? So our ribs are attached to our spine, and those are called the facets. The lumbar vertebra, now these ones are the thick, bulky ones. They support the low back. Think of how much support they have to have, okay? So they're the largest, thickest, with large spinous processes and transverse processes. Movement occurs, but there's less flexion than extension because of the curve here. So they're much thicker. The sacrum, this is the fusion of 5 vertebrae into the 2 hip bones. Remember we talked about the SI joints and the sacrum? So this articulates with the hip, the ilium, to form the SI. And the SI is, remember, where the body weight is transferred into the lower limbs with sitting and standing. It's incredibly stable as well because they're fused together. This is formed when you're an adult. And then there's the coccyx at the bottom, which is your tailbone. Now, movements of the vertebral column. There's flexion and extension, right and left lateral flexion, right and left rotation. The degree of movement changes depending on what part of the spine you're in. Cervical and lumbar regions allow for extension and flexion. Thoracic region have minimal movement, but account for about 20 to 30 degrees of movement, inflection, and extension. So you want to think about this. So even in those pictures, you can see when you're doing right lateral flexion, okay, the thoracic vertebrae aren't moving that much. They're still in alignment. The movement is down in the lumbar spine, okay? That's what you're looking for. When you do hyperextension, the movement is in the lower part of your spine. That's what we're talking about. Now, how do we move? Okay, so flexion of the cervical region, that's your sternocleidomastoid muscle and your scalenes. Extension of the cervical is your upper trap. Lateral flexion of the neck is all muscles on one side contracting unilaterally. So only one side connects to cause lateral flexion. Rotation, it's the sternocleidomastoid and the upper trap of the opposite side to help with rotation. Flexion of the trunk is lengthening of the deep muscles in the back, superficial back muscles, and contraction of the abs and hip flexors. Extension would be the opposite. Okay, stretching of the abdominal muscles, and then contracting of the lengthening of the deep and back muscles. 75% of flexion occurs in the lumbosacral joint. Remember I said in flexion it moves at the bottom. Extension, like I said, is lengthening. Trunk rotation, it's external internal obliques. Lateral flexion, it's your quadratus lumborum, obliques, and your iliopsoas and rectus abdominis.